The main thing that you need is a heart for the people that you're serving.
So 1987 was the rural doctors dispute in New South Wales, which came about because the Commonwealth, in an attempt to crack down on the 24-hour clinics, took away the after-hours loading on the medical benefits.
Well, the Rural Doctors Network was an integral part of our settlement with the government after our big dispute. When it started, there was emphasis on locums, terrific. Emphasis on relief for the smaller towns, terrific.
RDN put satellite dishes into all the small hospitals. Doctors could get their CPD by going up to the hospital at night and having some sandwiches and getting CPDs.
The key elements were to create a network of people, a forum where people could get together, they could discuss their issues.
In terms of somewhere to go, a town wanting a doctor had nowhere to look. Well, now I just refer them all to the Rural Doctors Network.
The RDN now is at a really good point of being an independent, well-respected organisation that is concerned about every area of the state and is able to put their resources and their time and their efforts into local communities.
Adequate healthcare within a community contributes, I think, significantly to the dignity of the community.
For me, I think the standard of rural health and the quality aspect is very high. There are some of the most incredible people doing the most incredible work in rural communities, and that needs to be celebrated.
These brilliant young doctors coming out of the rural clinical schools, I think they're absolutely fantastic.
It's been really helpful being a cadet. I feel like I've already been immersed in what it's like to be a rural doctor. I've had the opportunity to meet some really fantastic rural practitioners and learn to them and talk to them and learn about what my future career could potentially look like.
It's the N in RDN that's been so important to me. It's the family network that the Rural Doctors Network brings.
There was a kind of intimacy with the people that you work with out in communities. When I go out to a town, I will always bump into someone I know because of who I'm affiliated with, and I think that's been one of our strengths, and I think we have to make sure that we never lose that intimacy.
Rural health means to me an opportunity for people to access services no matter where they live, and I think people who live in the country deserve to have as good a healthcare as people who live along the coast or in larger cities.
I think one of the really important conversations that RDN continues to have is about Aboriginal health and wellbeing. We're incredibly lucky in this organisation to have very strong relationships both in community with the Aboriginal sector all the way through to their peak body, and the Aboriginal Health and Medical Research Council, MOU, is a fundamental part of the work that we do.
I think it's really important as we move forward for us to really not be framing rural medicine as a problem. We're looking for solutions, and by expanding into supporting our allied health colleagues, having not just a doctor in a town but also having physio and a dentist and all the other groups that keep the patients well and healthy, that's something that we're more and more recognising the value of.
Our future, we need to talk about access in remote communities, in rural communities, and then regional centres as well. We really want to go to where is the most need and to really work with community to understand exactly what they feel they need to support service provision, but create a viable and sustained and quality health service, and that's our ultimate goal.
I really do believe that if we look at what we have and get everybody working together really cohesively as a team, and that's something that the RDN does very well, then we can find really innovative and creative ways to suit a workforce requirement in an individual area.
I see RDN as part of the family of rural general practice. It's a big, diverse family, but families look out for each other. And I think that's always been RDN's role, and I trust that it'll continue.